Over the years, Northern Uganda has suffered a series of disease outbreaks. The mysterious nodding syndrome, Ebola, and hepatitis E have plagued the region at one time. Now, a malaria epidemic that struck mid-last year has so far claimed 658 lives.
Generally, in Gulu district, we used to manage about 1,000 cases of malaria each week. But now we are managing between 9,000 to 10,000 cases of malaria per week.
This rise in the number of cases puts a strain on the meager resources of the districts, especially in regard to the consumption of the anti-malarial drugs and the increased workload of the health workers.
Over the last two months, we had suppressed this, especially when we had intensified the community mass fever treatment by the village health team. But we ran short of the medicines, and that has increased the numbers.
In response, the Ministry of Health has sent 374 health workers to the region.
These are mainly going to undertake case management, that is treating people who come to the facilities.
The worst affected districts are Agago, Amuru, Apak, Gulu, Kitgum, Kole, Lamwo, Nwoya, Oyam, and Pader. The Ministry's interventions target 285 health facilities, including general hospitals, Health Center 4s, Health Center 3s, and Health Center 2s. These include 38 health facilities in Agago, 26 health facilities in Amuru, 55 health facilities in Gulu, 28 health facilities in Apak, 20 health facilities in Kitgum, 26 facilities in Oyam, 31 in Pader, 22 in Lamwo, 13 in Nwoya, and 26 facilities in Kole. One doctor will be stationed in general hospitals, 2 doctors at Health Center 4s, 2 clinical officers at Health Center 3s, and 1 nurse at Health Center 2s. Funding for the intervention is supported by the Global Fund.
We also plan to undertake indoor residue spraying in all these districts that have been affected. We have oriented village health teams to be able to manage malaria at the household level. In a short time, we shall be availing drugs to them to be able to move home to home to check out those who are sick. They have been oriented on how to test for malaria. And in this, when they find people positive for malaria, they will be able to administer drugs to them. And in such cases where they will not be able to manage, they will refer them to health facilities so that they are handled by the trained health workers.
At least 22 billion shillings has been committed for the exercise, which is expected to begin mid this year. More funds were sent to the district to support data collection, mass treatment of fever at the community level, and the management of malaria in schools. Meanwhile, the Ministry of Health appeals to the general public, especially those in the affected areas, to sleep under an insecticide-treated bed net for protection against mosquito bites, destroy all breeding places for malaria vectors by slashing compounds and clearing dirty, stagnant water near their homes. And those already diagnosed with malaria are expected to complete the anti-malarial dose given to them. The public is also advised to work closely with the village health teams to monitor and report cases to the health facilities.